I'm super excited to be here today, share with you the amazing story of Naomi Goldapple, and help share some of her insights. Naomi has one of the most non-linear, like badass careers in Canadian health tech that I've seen. We're going to unpack not just kind of the big AI stuff, but how she's made really gutsy decisions along the way to have such an interesting career. Naomi Goldapple is SVP of Data and Intelligence at AlayaCare, where she leads the company's AI and data strategy to transform home healthcare delivery. She started her career at IBM during the dot-com era and then became a repeat founder, early stage operator. She launched a really popular concept in Montreal that was called Maman Bébé Café. That was a community space for new mothers. And then she helped build AI startups like Nexology and Element AI. And then at AlayaCare, over the past 6 years, she's built an AI team that ships real production-grade tools for clinicians that add true value to their workflow and actually accelerate the care that people receive in their homes. So today, we're going to dig into her journey and what it really looks like to build such an impactful career in a complex and very highly regulated industry like healthcare. So with that, we'd love to have Naomi come join me up here for our chat. All right. Thank you.
Very comfortable.
They are really comfortable. We haven't sat down yet. Okay. Well, Naomi, you went from IBM to Maman Bébé Café to Element AI to now running AI at one of the biggest home healthcare platforms in Canada. So the first question I wanted to ask, and I think this is a great way to kick it off for everyone to kind of get to know you, is what is the weirdest or like most unexpected career choice that you made that actually really paid off?
Great question. And there's a bunch of things missing between those big chunks. So I was just like, geez, I'm old. I've been doing so many things. Definitely, hands down, kind of deciding to jump out of, a cushy corporate life and jump into entrepreneurship with not having, I don't have an entrepreneurial family, wasn't in the entrepreneurial scene. So that was a big thing. And, it's amazing. So not only is it super empowering because you actually feel like, wow, I can do this. This is really great. But, also I then got to know the entire startup ecosystem, which in the end, I wish I kind of knew before, because then I would have known how to like refinance a company and, all that kind of stuff, but that's fine. So that really launched me into meeting everybody in the Montreal startup community. At the time, it was even called Montreal Startup Community, right? And, which was Danielle who started that, right? Danielle.
Who introduced us from our last.
Was the one who introduced us, that's right. So jumping into that, and I feel like that has just completely changed the trajectory of my career. And, once you're an entrepreneur, it's really hard to go back, right? And kind of work in a, it's not that hard to go back, but it's hard to not be in control of that. So that has 100% shifted, everything I did since.
It's hard to start following rules again. Like when you leave the startup world.
Well, you feel kind of constrained, right? You're just like, why can't I just go do that, right? So yeah, so
true.
That's it, definitely.
So I want to touch a bit more on Maman Bébé Café. It was beloved, award-winning. But unfortunately, in the end, it was not profitable. So I would love if you could tell us a little bit about what Maman Bébé Café was and how that experience shaped you, and especially how it shaped how you think about building products that people love and will pay for, but also products that people love and will pay for and that are profitable.
Yeah. Okay. Great question. You can put the first slide since I actually have it.
Super.
Yeah, there we go. So, let's see who actually has had babies. There you go. So, nice corporate career. And then, having a baby is probably the biggest change in your life. And I did not have a network when I was living in Toronto at the time of other people having babies. And it was November, it was, snowy. And I was like, wow, what am I going to do for an entire year with this baby? Right. And I was very sporty also. So I wanted to like continue doing sports and like, how do you do that? Anyways, basically my gym in my second mat leave opened a daycare where you could go to the gym, leave your baby, do some sports, and then go back. And I was like, this is amazing. And I knew I was going to be moving back to Montreal because my husband is Francophone. He was like, as soon as the kids are going to be 2, we have to go back to Montreal so they learn French properly. And so that was on the path. I said, Montreal, the winters are even longer. So people are even more isolated. So, did all that, put it all together. And it became a center where you'd go to get back in shape mentally and physically. So lots of classes, with mom and baby Pilates and mom and baby salsa and all that kind of stuff, but also a play area and a place where you can have really healthy food. And it became like this real community spot, like in Montreal. So it became very popular. I won all the entrepreneurship prizes that were possible, and all that stuff was great. It was in every, TV, like all that kind of stuff. But in the end, the goal of a business is really to make money, right? And I really fell in love with the concept. I loved going there every day. It was wonderful. I was trying to what vestiges, and there was still a vestige online. I just Googled. I'm like, okay, you can still see some of it. One thing I thought was really cute, but I see it doesn't show up, is right at the end, the person who wrote this, she said, this place is also available for birthday parties. I'm sorry, I forgot my camera, so I can't show you my own pictures. I was like, that's so cute. That was from 2009 when people didn't have cameras on their phones. So I was like, that's really cute. But yeah, so I think you fall so in love with what you're doing, also because people are telling you it's great. But really, a business, the only one who really suffers from that is you, because when it's a beautiful day in July, and I'm still paying for, the rent and the internet and the food that has to be there in case people come in. But everybody's at the park and nobody is really signing up for stuff because they can go outside. You still have all those expenses, right? So I think for me, what I really learned is you have to take care of the business model. So even today, so AlayaCare, we're 11 years old. The company is 11 years old. And I can say this, we just literally, September and October, we finally turned a profit. So it took 11 years to turn a profit.
That's crazy, but congrats.
Right? Which is, it's amazing.
With the help of your AI products.
Yes. But the problem is, because when you start, you're so willing to do whatever will make your customer happy, right? So you're so willing to customize and not think about, how am I going to make this repeatable and easy to deliver so that it is actually cost efficient. And I definitely did not pay enough attention to that. So when, the seasons that weren't as high volume came, I wasn't really prepared. And then, actually having those type of strategies. And then I was like, well, I'm going to start franchises because that's how I'm going to be able to make money. But franchises are really like glorified babysitters. So in the end, and then I started to fall out of love with the concept, probably because then I had a third baby and I was like, I've had enough with other people's babies. So I said, I'm going to sell off the parts. But for me, the part is really, you have to, if you want to run a business, you should fall in love with it so that you're interested every day, but you've got to take care of the business model and not fool yourself, because it's going to come up and bite you if you have too much customization and too many different models happening at the same time. So true. So true.
Like you said before, I have to jump a couple of the interesting chapters of your career.
Yeah.
You almost have this love for really difficult businesses and really difficult industries. So Maman Baby Café was a difficult business. For people who don't know home healthcare is a really difficult industry. So maybe if you could share what's one of the most surprising things that you learned when you started AlayaCare about how care is delivered in home settings.
Yeah. I mean, it's funny. We have an expression. We always say, you've seen one home care agency, you've seen one home care agency. None of them are the same. So that makes it tough. I think, home care, when you think about it, you're like, okay, how complicated can it be? People, show up, they help you do something at home, and then they leave. But, the regulations for every single, province, state, country, everything is different. There's many different payer models. So all that stuff is complicated. But, I think, some of the stuff that I found really amazing, especially south of the border, there's always a labor shortage. Always. There are not enough caregivers because it's a really tough job. It's a bit isolating. You're going by yourself from home to home to home. A lot of times they don't have a lot of training. They're just going there to, maybe tidy up, maybe help people take a bath, a lot of that. Then there's, of course, the clinical side, which is more clinical. But so it can be extremely isolating. So everyone's always looking for more labor. And I remember I was at one of our customers in Chicago, and I was like, well, how do you do your recruiting? And they're like, well, we just have people come in off the street, we fingerprint, and if they're not a felon, then we put them to work. I was like, wow, okay. So that's like, they're so desperate for labor that, you could have somebody off the street the next day, they are changing your grandmother's diapers, right? So it's that to me is extremely surprising. Also, you would think that why there's such a labor shortage is because it's not very well paid. But when you look at the data in terms of why there's such high turnover in the industry, it actually has very little to do with pay. It's these are people who kind of have a calling and they really enjoy what they do. It's mostly about schedules, like, is this the right schedule? And can they actually make the ends meet? A lot of times they're paid by the hour. And, people always want to be seen in the morning and they want to be seen in the evening. And then the rest of the day, they're free. So that's not enough. So they have to take other jobs at the same time, so they work like at 3 or 4 different agencies to try and make ends meet. So it's tough. So I think like the loneliness of it is very tough. But also like the business model, a lot of times it just doesn't make any sense. It's like, why don't we pay these people decently? Why don't we give them full hours? And we could probably solve a lot of those problems.
That would be fair. It would be very fair.
Yeah.
So like you said, it's like terrible margins, workforce shortage, like regulatory changing, regulations changing in like every postal code. That also screams to me like industry where tech can actually make a big difference, or like being able to track regulatory differences in an automated way and like figure out if things are going to work or not. So I'm curious, when you were first hired at AlayaCare and you started Alaya Labs, what was the first like burning problem that they hired you for, and how has that changed over the past years?
So the first burning problem was employee turnover. It was like at 84%. So, imagine if you have 100 caregivers or nurses, by the end of the year, 84 of them would have left. Like that is like, it was just crazy. And then COVID hit. So it got even worse, if that's even possible, right? Because then your workforce, a lot of immigrants come to take those jobs. So the borders were closed. The care workers themselves had to stay home with their kids. And so that labor force really got crunched. And then COVID changed everything. Many people left the profession. Many people did. During COVID, you could make more money flipping burgers than you could being a care worker. So a lot of people left the profession. So that's tough. So when you ask what is the biggest problem today, it's embarrassing to say it's the exact same problem. So our population is still getting older. That's not going to stop. And there's still less and less people who want to join that industry. So technology is still the number one way. Luckily, right now, there's a lot more technology at our fingertips that really does help that profession. But I'd say that's the number one was always retention. And retention, the number one thing that drove retention was actually the schedules. So are they getting the hours that they need and the hours that they can actually deliver? So when I started, I focused on, okay, let's do employee retention models. Let's try and project, let's see if we can have a machine learning model to say who is at risk of leaving, right? And we could like mitigate. And then because we knew scheduling was part of it, we worked on a lot of schedule and route optimization algorithms to make sure that we had the right person, the right time, less time in the car, more time with the patients. So that was what we did. And then on the clinical side, the number one thing you want to avoid in home care is somebody going back to hospital. Right. So any type of, you want to avoid readmissions into hospital. And in the States, in fact, your reimbursements are in jeopardy. If somebody is in the care of home care and then they get back to the hospital within 30 days, you get dinged, as well as the hospital themselves will get dinged. That's why they always want to give their patients to home care agencies that they trust to keep them out of hospital. So we develop models to predict who at home is at risk of being readmitted to hospital. And so then you start looking at, well, what drives readmissions? So what's the number one thing do you think that drives somebody at home getting back to the hospital? Fall, yes. So are they going to fall? Of course they're going to fall. Everyone's going to fall, right? So it's not, will they fall? Yes, they will. But how many times will they fall? Will something bad happen when they fall? Also, prior hospitalizations, a lot of them are frequent flyers, right? Like if you've been in the hospital a lot, you will probably go back. And then there's other things that, maybe we don't think about as much that really comes out in the data, but, mentions of pain, right? Very high correlation that, if they start mentioning pain, they're going to be, end up in the hospital the next day. things like UTIs, which, sometimes mimics as, confusion and dementia, and also causes falls as well. So there's a bunch of things that came up in the data. So we built a model to predict who is at risk. And now the clinical supervisors, they can come in the morning and say, okay, who's in my cohort, and let me filter on who is highest risk and trending up, and they can kind of allocate the resources for that day. So those problems still exist. We actually have better tools to try and address it now.
Interesting. I keep meeting startups who are pitching me like softwares that they sell to nursing homes or care agencies to try to do this exact thing.
Yeah.
And they're all like, oh, like, we can't handle this. Like, and it's amazing that you guys have your own home care agency that simply does this, like, basically from
Well, I think we have something like 850 different customers, and a customer could have home care agencies all across in every state. Like they're very big, so we have a lot of data. So it really helps when you have the data in the platform.
Data is king.
Data is king.
I find it amazing that the story of like the tech products starts with scheduling. Like it seems like so many tech companies always start with scheduling. Like there's the classic story of Microsoft and like Bill Gates making the school schedule or whatever. So it's funny that in 2025, however many years later, like it's still a problem that like we're using tech to solve and that we haven't like just solved
it. Well, it's funny because actually AlayaCare, the platform, was built upon the chassis of another, it's hard to build like full ERP systems. It takes a long time. So Adrian, who's the CEO, was like, my buddy, who has a company called TrackTick, they have workforce management for security guards. And I was like, how different would that be? Nurses, security guards, it's pretty different. But anyway, so it's built on that. So sometimes in the code, you're like, why is that a guard? Why is that, so sometimes there's vestiges of that weird terminology in there. But all that to say, that was the same thing. But we're also sometimes constrained by some of those assumptions that were made a long time ago in the software. But yes, scheduling is, leads to efficiencies.
So, one thing that is kind of like coming, like that's kind of, this feels like it's kind of synthesizing too, is that like home care is a traditionally like so brick and mortar, like very like antiquated industry, one would think. And yet tech has such a role in modernizing it, improving access to it, like improving the lives of the elderly. So I think it's really interesting how, we often like to think of AI in like a biotech context of like, how can we develop like better drugs that will absorb like 1 millisecond faster? So, we're always trying to optimize things, but we kind of avoid some of the really obvious healthcare use cases. And like we've kind of mentioned that home care kind of has an image problem where young workers don't necessarily want to work in home care because it seems awful and like people like are churning everywhere. So I'm curious, what is the role of tech in creating a more attractive industry for young workers and like bringing more people? Because ultimately you need people to provide home care. Like there needs to be a human component. It can't be, robots in homes. We were laughing about this, like companies that
we'll get to that.
But, so like, what do you see as the role of tech in making this industry more attractive and better?
Yeah, well, I mean, our goal is that, when companies are trying to attract caregivers, that they're like, oh, you're using AlayaCare. Okay, I only want to go if you're using AlayaCare. Like that's what we really want because they already know it. It's easy because you do see caregivers are like, oh, you're on, home care, home base. I hate their interface. I don't want to be on that. Right. So we really do see that. So that's part of it. But nowadays, like it's amazing what we can do. So, with LLMs, it really is, it is changing. So there's always tons of documentation. So right now we're offering to the nurses, when you're in the home, you can literally dictate, right, what they're observing. And that can, while they're dictating, it's automatically filling in the forms that they need filled in. And then, at the end of it, they can still be there, like looking at them in the eye, not having their nose, in a tablet. And then, afterwards they will upload, they can then edit it and boom. And before they leave to the next visit, it's all done. Right. So, here in Quebec, we're, implementing at one of the CUs. So I guess most of you are from Quebec, so if you're here, I imagine. So it's a little more antiquated than some other parts of Canada and some other parts of our other markets. A lot of paper still exists, which anyways, this is our goal, is to make sure that by the time we need it, it's going to be working well. But for example, the nurses here, they work from 8 to 12. right? So they'll do home care visits from 8 to 12. And then in the afternoon, they will do the paperasse, right? They're going to go back to the office and they're going to do all the paperwork that they have to do. And we're like, okay, well, now that you're on here and you actually have a mobile, you don't need to do that because you don't need to go back and do all your paperasse because your paperasse is already done by the time you're at the next one. I was like, oh, and the unions are like, no, they only work until 12. So we're like, but you could actually double the amount of visits. So those type of things, this is kind of what you're up against, like in certain areas. So we're trying, but you can see some of those efficiencies are extremely obvious. And also with the scheduling, they spend, they on Thursday afternoons, they print the schedule for the next week and everyone comes to the office and they give them their papers. Right. And of course, those schedules change a lot. So there's a lot of phone calls and texting and all that. That's what they do for the rest of the week is they change the schedule that they printed on Thursdays. So now we're starting to get them on board and it's like the schedule's here. You don't need that Thursday thing. And if there's somebody calls off, you're like, who would be a best match? The optimizer puts them in and that's it. So they're just kind of like, so what do we do all day? Right. So it's an interesting problem because they're the ones who are testing it, but they're also the ones who, made their job they could do other things right that are not as repetitive. I forget your first question.
No, it was like, how do we make this more by scheduling?
Yeah,
so start with scheduling.
So, but also more radically. But one of the things I always look, south of the border as well. Hopefully, it's the next one. Yes, it is her. So when I first came, also one of the things I was talking to Adrian about, I was like, we should almost start like a reality show. Because you need to have like, I don't know, a bunch of maybe hot caregivers, male and female and whatever. And, really show people what this industry could be. Because you've seen there's, people who work on yachts or people, all kinds of industries that have been bubbled up. So we almost said like, we need to do what like Starbucks did for baristas, like for home care. And I was at the Home Care 100 conference last year in January and met this lovely nurse she's nurse Hadley. She's very young and she's a hospice nurse. So we don't really have this as much in Canada, but so there's home care hospice. So these are people you're in hospice if you are, supposed to die within the next 6 months, then you're considered in hospice, right? So they still come to your home. It's extremely lucrative because once you're in hospice, then you're paid like per diem. So their goal, like the goal of the home care agency is actually to see how much they can be in hospice without actively dying, right? Because when you're actively dying, then they actually have to do stuff and they have to administer medicine and all that kind of stuff. So it's a bit of like, they try and not be 6 months and not get caught because then it could be fraudulent. And anyways, it's a funny industry. But what this home care nurse, she is a hospice nurse. So basically, and she's probably a little older now, maybe she's like 23. And she is so active on TikTok, on Instagram. I was showing if you follow her, she does amazing stuff. So she's just like, follow me, a day in the life of, and she makes it sound, and I think, and you believe it, so meaningful because she's like, there's so much, I think her thing is like, there's so much life in death. And she makes it really a beautiful process. And you see her and you're like, I would love to do that. It looks like the most rewarding career. So she's doing wonders for this. So I think, more and more these type of things really, really have to happen.
I totally agree. Yeah. And I would totally watch that show. I love those strange, the yacht shows.
The yacht ones. But it would be like, I know Obama, they did something where Obama had something where he was like looking into different careers and kind of like doing a day in the life of, I don't know if you ever saw that. It was a while ago. And he did one for a home care worker. And it was like heartbreaking because it's a person who's paid something like $11 an hour and not even paid for the mileage, right? And sees that their patients needs things and would actually go buy it themselves and bring it to them. And you're just like, and Obama was trying to show people that anyways, there needs to be more of that.
For sure. Yeah. Before we move to some rapid fire prompts really quickly, do you have any, we talked a little bit about Quebec being really antiquated. Do you have any like little anecdotes or experiences with weird regulatory differences between territories, whether it be Quebec or not? We don't always have to come for Quebec. Yeah. It's an easy target, but any weird regulatory differences that have affected your job?
Yeah. I mean, so there's something called electronic visit verification. So right now, this is something that, in Quebec, they're pushing back on a bit. So right now we have something that, when you come to a home, you clock in, right? So you clock in and you clock out. And the GPS should match. So there's been, especially in the States, there's a lot of fraud. So people would clock in, they're like, miles away from where they're supposed to be. So then it looks like, they'll get paid for a 45-minute visit, but really they were only there for 10 minutes, right? So the government really imposed something called electronic visit verification. So you clock in, it has to show with the GPS that you're in, and then that has to actually be reconciled. So then they can actually be reimbursed. So, and of course, most states have it, except for one state, Ohio, is like, we don't want any GPS. That's too big brothery. So you're like, of course, right? There's always one. So you have to try and, figure those things out. And we had a bunch of pushback from unions here in Quebec who were like, that's too big brother. We don't want, and the thing is mostly it's for safety also, to make sure they clock in, they clock out, right place, right time, make sure if they're going to be late that, all that kind of stuff. But a lot of change management has to go with that. In Australia, they have something called home care packages. So they turn everything upside down. So if you are eligible for home care, they basically, to the patient, they're like, okay, you just, I don't know, you had your hip replaced and you're going to be in rehab. We are going to give you $20,000 for home care. You figure out how to use it. So you kind of like here's your amount, and then you keep wearing it down. And I'm like, how are they supposed to know how much they need? Anyway, so they have a whole industry around that, on like people who help you to decide how you should be charging it. So it's unbelievable the way, different ways. And of course, I hope that comes to Canada, where you're not just paid transactionally just because you showed up. You're actually paid based on outcomes. So they have a bunch of, things like, did they fall? Are they actually getting better? Were they able to do all of their activities of daily living? So if all those things happen, we will pay you. And you know what? We might even give you a bonus if you're better than, your competitors. So I think that stuff is very good, because the incentives have to be there.
For sure. And tech helps administer value-based care better, like track outcomes in value-based care. There's such a world for tech in healthcare administration and delivery that's so important to consider.
All the decision-making stuff, like I was saying about identifying risk. I mean, they love what we built, because they're just like, wow, we can actually mitigate risks and make sure to keep them out of hospital. And that'll, and then it makes everything go round, right?
For sure.
Yeah.
So a couple rapid fire questions for you before we move on to some Q&A from the audience. I wanted to come up with like a couple questions, just, hopefully easy to answer or quick to answer. First, I'm sure everyone's dying to hear, like, what do you think is the most overhyped thing in AI today? If someone were to come up to you at an event like this and say, what do you think about AI? Like, what would you first talk shit about?
Okay, this goes against all of our marketing campaigns. I mean, just to me, like, just agents. I'm not saying Gen AI, because honestly, I think
agentic frameworks for XYZ.
Yeah, like whatever you think an agent is, it probably isn't doing all that. I think that has been extremely overhyped. And also, I think when we get to the time when agents are actually working together as a team, and like they're just part of your team, I think we're a little bit far off. So I can even say we are launching a bunch of agents, and the agents under the covers, they're quite deterministic at the beginning, because you need them to work, right? And you need them to be very explainable. You need to be able to observe them. And, in this world of Gen AI and the democratization of LLMs, everybody and their uncle has become like an ML expert, right? But a lot of them don't have the actual backgrounds. So sometimes when I go to conferences and I meet people and they're telling me about what they put in, I'm like, oh, that's great. I'm like, so how are you actually evaluating that? They're like, oh, I think Azure does that. I'm like, no, it doesn't. What do you mean Azure just does that? Like, they really don't even know that models should be evaluated. You need evaluation frameworks. And it's actually a very new field of study, is like putting in these proper evaluation frameworks, especially for home care. So I know we're starting a project with Mila, who's the Montreal Institute for Learning Algorithms, to really put together this home care framework specifically for an agent that we have, to make sure that it's actually doing the right things. But wait, I went off topic.
Super interesting. Yeah. Well, we were talking about how agents are, so you got your fix already. So that's great.
Yeah.
Amazing. What is the most under-discussed opportunity in home healthcare?
I mean, I think robots. Like, I really, really do. I mean, not robots that are going to come and, lift your grandmother out of bed and do that stuff. That's just like crazy. But I mean, if you think about like a care worker shows up and the care worker does the human things, but let's say they are out, they could be out, like, I'm going to take you for a walk, I'm going to give you a bath, going to do that, while some sort of robot is cleaning the house and doing those other things. I don't think there's anything wrong with that. And there's many robot type things that are coming onto the market now. I'm sure you've seen some. Well, I'm sure after, I don't know if you've seen the new Neo. I mean, now, so I think people aren't talking about it enough. There's also, robots are hard because there's not enough training data, right? So right now, like the self-driving cars, they have lots of data because everybody drives. The robots, you can see people are trying to train them. So if you've ever seen some of these Neo things, it's quite funny because there's just a human behind telling it what to do and kind of like with a joystick. You're like, well, it's silly, right? It takes 40 minutes to undo the dishwasher. So that's where it's at right now. But there are tasks that can really, really help. And I think like be more like in symbiosis with humans. And I don't find like all of that, even like remote patient monitoring, like relying on devices. And I keep waiting for it to really, really, really happen. And our seniors are getting a lot more savvy. So they're fine with, have a lot more wearables, but still remote patient monitoring. You'd be surprised. It's mostly because nobody wants to pay for it, right? Who wants to actually take that on? Our government doesn't want to. The care agencies don't want to. So unless you're being rewarded for it, we need to find a place for that.
Yeah, it's funny. There are a lot of startups coming out where they're basically hiring people who have interesting jobs to wear GoPros on them and film what they're doing to train robotics in that space. So there's a company that I met that just does baristas, and they'll like put a GoPro on a barista. And it's funny. Last rapid fire. What's one prediction that you have for the next 2 years that would make the people in this room uncomfortable?
Can you put a slide up? So this is just one guy on my team. I found this just to kick this off. So his kids in school for Halloween, they said, hey, there's going to be like a robot in the schoolyard, whatever, taking pictures of kids in their Halloween costumes and all that stuff. We're going to upload it onto the website. If you don't want the pictures of your kid, then tell your kid to get out of the way of the robot. Like, this is literally what the school said.
Laval Junior Academy.
That's insane. I was like, what about an opt-out or anything like that? But just this idea that the robot has privilege over the kid. This is a little bit mild, but I am thinking some of the things that are a bit scary right now is we are kind of converging into some of the Black Mirror stories that we see where, really nowhere to run, nowhere to hide. You can see people rebelling against this, and in London, people are like smashing all the cameras that are everywhere, and you can see like all the deep fakes and all that stuff. But there's so many things to talk about. So I think there's in terms of privacy and security, that is definitely uncomfortable, but also the divide between the automators or the creators and those that may be put out of work, and trying to fix that with universal pay. I think there's a lot to think about in the future. So I do think we need definitely more regulatory bodies. The regulatory bodies cannot keep up with the pace of change. And I think the thing that worries me right now the most, not that that was your question, but I'll say it is that the big companies like the OpenAIs and even the Googles, I find now what they're doing is they're just putting out what they want, and then they'll see if there's a problem, then they'll try and fix it, as opposed to trying to fix it before. We just saw that with, Roblox, and they're like, okay, there's a bunch of creepy stuff, targeting children, and is like, well, shouldn't you try and fix it first? Shouldn't you be the one that's kind of like trying to look around the corner before? But I find they're like, let's go with it. We've got masses of users. And then if there's a problem, like, yeah, those chatbots aren't really very encouraging, or they're putting people in the wrong path, then we'll deal with it. So I think everything all at once right now, and we need to not to slow down, because I think there's a lot of good, but I think we need more regulatory stuff.
There's a really great essay series I would recommend to everyone about this called Situational Awareness from this guy named Leopold Aschenbrenner, who used to be on the super alignment team at OpenAI before it was dismantled. And he wrote this series of 10 essays about like how we can't slow down, but we have to look around the corner, like you say, and like we have to understand what's going on. So super interesting, and it's free online. If
It just the creators, the automators have gotten like so much power.
Yeah.
So it's they with that great power comes
great responsibility. So with that, thank you so much, Naomi. Like this has been so insightful. I think it's so important to realize not only is tech interesting in our phones on ChatGPT, like not only does it automate our lives with like note takers and different tools in Notion and all this, but it also allows healthcare industries to deliver care more efficiently. Hopefully allow people to make more of a living in healthcare and like have better services that are available to more people. All right. We're unfortunately out of time, but thank you all so much for coming. Thank you so much for listening. Thank you so much, Naomi. Thank you. It was great getting to share your story a bit more with the audience.
Thank you. It's a good audience.